Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Parkinson's disease is the second most common neurodegenerative disorder, and it has an annual incidence rate of approximately 1 in 600 people aged 65 and older. That means in any given year, 1 in 600 people who are over the age of 65 develops Parkinson's disease. Now, the cause of Parkinson's disease is currently unknown, but it's thought to be a consequence of both genetic and environmental influences. In other words, you can be born with a genetic predisposition to it. Doesn't always mean you're going to get the disease. It seems to be that in many cases, environmental and lifestyle factors play a modulating role. Now, certain environmental factors have been shown to increase the risk of Parkinson's disease. Certain types of pesticide exposure, the consumption of dairy products, very interesting to see that one, and also head injuries. Things that have been linked to a reduction in risk of Parkinson's disease include smoking cigarettes. People who smoke actually have, this might be the one redeeming value of smoking cigarettes, is that it may somehow reduce the risk of Parkinson's disease, although I'm not recommending that you smoke for that reason. Also, higher intakes of caffeine, higher blood levels of uric acid, and regular physical activity have all been linked to a reduced risk in developing Parkinson's disease in these epidemiological studies. Now, regarding exercise, a number of studies have shown that people who engage in regular exercise appear to have a decreased risk of developing Parkinson's disease as they get older. But a study reviewed in Neuroscience News in September of 2022 has shed light on key mechanisms through which endurance exercise or aerobic exercise appears to be an important way to reduce the risk of Parkinson's disease. Now, this really looks to be important research. In short, researchers from Johns Hopkins Medicine and the Dana-Farber Cancer Institute in Boston have shown that a hormone secreted into the blood during endurance or aerobic exercise reduces the level of a protein linked to Parkinson's disease and halts movement problems in animal experiments with mice. Now, the protein released from muscles during aerobic exercise, and this is true in humans as well, is called irisin. Now, irisin can go from the blood and cross the blood-brain barrier and block important steps that are linked to Parkinson's disease. So these researchers showed that mice that are genetically engineered to be at high risk for developing Parkinson's disease are spared the development of Parkinson's disease when researchers are able to inject irisin into the area of the mouse brain where Parkinson's disease develops. This research helps to explain why people who perform aerobic exercise are less prone to Parkinson's disease development, and helps to explain one of the ways that exercise helps to slow the progression of Parkinson's disease in people who are afflicted with it. So biotechnology research companies right now are very busy trying to make an irisin drug that can enter the body and make its way to the brain, or find a way to deliver irisin directly into the human brain. Now, this intervention may reduce the risk of developing Parkinson's disease, so it could be used for prevention, and it could be another important aspect of Parkinson's disease treatment. But this science and technology is still many years down the road. In the meantime, one way to prevent Parkinson's disease, as well as to improve cardiovascular fitness and burn more fat and also improve brain function, is to do aerobic exercise regularly. That means 4 to 7 times a week. Because when you're doing aerobic exercise, it releases irisin into the bloodstream from the muscle tissues. The irisin crosses the blood-brain barrier and it prevents the clumping together of the protein in the brain called synuclein, which is responsible for killing the nerve cells in the area of the brain that cause Parkinson's disease. So these are nerve cells that normally secrete the neurotransmitter called dopamine. So irisin has also been shown to speed up the breakdown of synuclein so it doesn't accumulate in the brain and clump together. So if you can prevent the clumping together of synuclein in the brain, the chance of getting Parkinson's disease is tremendously less. Irisin does that. How do you get irisin into the bloodstream and into your brain? You do aerobic exercise. Any way you look at it, including aerobic exercise in your wellness, longevity, and healthy life expectancy game plan, is good preventative medicine, and this appears to be also include reducing your risk of Parkinson's disease as you get older. So I've included the references for this information in the text below. Thanks for watching. I'll see you next time.